wRVU. Dre had an album or a concept, I think it was called Dre Day. Well, today is Drain Day. I know that's a bad pun, but that's what it is. I got 1, 2, 3 drains, maybe 4. I got a patient that got transferred from outside hospital with a large diverticular abscess. That's 1. 2, I got a patient that transferred from our sister hospital. It's got a perirectal abscess. Apparently it looks like a U. It does look like a U. I checked it out on CT. It does sort of look like a U. Just circumferential right around the anus there. Perirectal abscess. 3 is actually 2 drains. 1 on each pelvic sidewall. That's the post-operative collections. There might be a 4th. When I called the CT tech to talk about the drains, she mentioned that there was a patient in the ER with purulent vaginal discharge, possibly requiring a drain placement. So that is 4. This is what it is. This is what IR is. You know, IR is competitive right now. IR is being talked of next to specialties like plastic surgery and dermatology. But IR is not glamorous in any way. IR is not glamorous in any way. Dermatologists, you could be in Beverly Hills with an office, seeing patients for cosmetic work. You could be a plastic surgeon in Beverly Hills, doing all sorts of aesthetic surgeries. But interventional radiology, you might be not in Beverly Hills, but you might be in the valley doing drains on call. So it is what it is. I like IR. For me, IR makes sense. It's a transition from radiology away from the workstation into a clinical service area, a procedural work area. It made sense for me. It was exciting for me. After sitting in a chair for hours upon end, reading cases, IR was a nice escape for me. But if you're looking at IR as a student, you don't know IR from that standpoint. You don't know IR as an escape from diagnostic radiology. You're just looking at IR and trying to evaluate it. You might think because of the competitiveness of the field that it's like plastic surgery and dermatology. It's not like plastic surgery and dermatology. You will be on call on Labor Day coming in to do drains. Now again, for me, I enjoy it. It's exciting. I like it. But understand what it is that you're getting into. Glamorous specialty IR is not. Literally, I'm going to go in. My first case will be draining feculent material out of a collection in a patient's pelvis. So that's the first thing I'll be doing. It's a good thing. It's a life-saving or life-improving thing. It's something that needs care. It's something that needs integration of imaging, procedural medicine, use of conscious sedation. So again, it appeals to me, but you know, make sure it's something that really appeals to you or speaks to you before you embark on this journey. Bells are ringing. It's time to go in. It's wRVU.